1. Which of the following is a key principle of trauma-informed care? A. Encouraging confrontation. B. Ensuring physical and emotional safety. C. Minimizing transparency. D. Promoting dependence on the therapist. Two. In the DSM-5, which disorder is characterized by a persistent pattern of social inhibition, feelings of inadequacy, and hypersensitivity to negative evaluation? A. Borderline personality disorder. B. Narcissistic personality disorder. C. Avoidant personality disorder. D. Dependent personality disorder. Three. A social worker suspects a colleague of unethical behavior. According to the ASWB Code of Ethics, what should be the first step? A. Report to the state licensing board immediately. B. Confront the colleague directly, if possible. C. Notify clients who may be affected. D. Contact law enforcement. Four. Cognitive behavioral therapy or CBT is based on the assumption that A. Thoughts influence feelings and behaviors. B. Unconscious conflicts determine behavior. C. Relationships are the root of psychological issues. D. Early childhood experiences shape personality. Five. Which of the following interventions is most appropriate for treating panic disorder? A. Exposure therapy. B. Free association. C. Play therapy. D. Motivational interviewing. Six. When working with culturally diverse clients, it is most important for a social worker to A. Avoid discussing cultural differences. B. Use a universal approach for all clients. C. Demonstrate cultural humility and seek understanding. D. Focus solely on the presenting problem. Seven. Which type of validity refers to the extent to which a test measures what it claims to measure? A. Construct validity. B. External validity. C. Internal validity. D. Criterion validity. Eight. A client presents with symptoms of depression, chronic pain, and fatigue. Which diagnosis should be explored first to rule out medical causes? A. Persistent depressive disorder. B. Major depressive disorder. C. Somatic symptom disorder. D. Generalized anxiety disorder. 9. In family systems theory, which term refers to the process by which family members influence each other's behavior? A. Triangulation. B. Differentiation. C. Homeostasis. D. Reciprocity. 10. According to Erik Erikson, the primary psychosocial challenge for adolescents is A. Trust versus mistrust. B. Autonomy versus shame and doubt. C. Identity versus role confusion. D. Integrity versus despair. 11. When a social worker practices informed consent, they must provide information that is A. Brief and technical. B. Comprehensive, clear, and understandable. C. Minimal to prevent overwhelming the client. D. Only verbal without written documentation. (12) Which of the following is an example of countertransference? A. A client projecting feelings onto the therapist. B. A therapist feeling anger toward a client resembling their own parent. C. A client resisting therapy progress. D. A therapist encouraging a client to explore past trauma. (13) What is the primary goal of motivational interviewing? A. To resolve ambivalence and encourage behavior change. B. To confront denial and resistance. C. To analyze unconscious motivations. D. To explore early childhood experiences. (14) A client reports hearing voices instructing them to harm themselves. What is the social worker's immediate priority? A. Explore the content of the voices further. B. Assess risk and ensure safety. C. Identify underlying trauma. D. Initiate cognitive restructuring. (15) Which of the following best describes a dual relationship? A. A social worker providing multiple services to the same client. B. A social worker sharing personal information with a client. C. A social worker having both a professional and personal relationship with a client. D. A social worker consulting with a colleague about a client. (16) A mandated reporter in a school setting suspects child abuse. What should they do first? A. Investigate the situation further. B. Report the suspicion to Child Protective Services. C. Discuss the concerns with the child's parents. D. Document the concerns without reporting. 17. The term burnout in social work refers to A. Vicarious trauma from clients' experiences. B. Emotional exhaustion and reduced personal accomplishment. C. Physical exhaustion from long hours. D. Compassion satisfaction. (18) Which approach focuses on a client's strengths rather than their problems? A. Strengths-based approach. B. Psychoanalytic approach. C. Behavioral approach. D. Medical model. (19) When using solution-focused therapy, a social worker is most likely to ask A. What caused your problem? B. How do your past experiences influence your present? C. What will be different when the problem is solved? D. What are the barriers to change? (20) In the DSM-5, which disorder is characterized by a fear of having a serious illness despite medical reassurance? A. Conversion disorder. B. Illness anxiety disorder. C. Factitious disorder. D. Somatic symptom disorder. (21) According to the ASWB Code of Ethics, when working with minors, a social worker must prioritize which of the following? A. The minor's autonomy over all else. B. Parental rights exclusively. C. The minor's best interests, balancing confidentiality with legal requirements. D. Avoiding confidentiality to ensure parental involvement. (22) Which of the following is a recommended intervention for a client struggling with alcohol dependence? A. Dream analysis. B. Motivational interviewing and relapse prevention planning. C. Psychoanalysis. D. Play therapy. LCSW. A licensed clinical social worker or LCSW is a highly trained mental health professional who holds a master's degree in social work or MSW and has obtained state licensure to provide clinical services. LCSW specialize in assessing, diagnosing, and treating emotional, behavioral, and mental health disorders through individual, family, and group therapy. They use evidence-based practices, such as cognitive behavioral therapy or CBT, trauma-informed care, and solution-focused techniques to help clients manage challenges like depression, anxiety, trauma, and relationship issues. In addition to therapeutic services, LCSWs often advocate for clients by connecting them with community resources, addressing systemic barriers, and promoting social justice. Their work is guided by the National Association of Social Workers or NASW Code of Ethics, which emphasizes integrity, cultural competence, and a commitment to enhancing the well-being of individuals and communities. Here are 5 top beneficial uses of LCSW. 1. Mental health therapy and treatment. LCSWs provide evidence-based therapy to individuals, families, and groups to address mental health disorders such as depression, anxiety, trauma, and PTSD. They use techniques like cognitive behavioral therapy or CBT, dialectical behavior therapy or DBT, and trauma-informed care to help clients develop coping skills and improve emotional well-being. 2. Crisis intervention. LCSWs are skilled in assessing and managing crises, including suicidal ideation, domestic violence, and acute mental health episodes. They provide immediate support, safety planning, and referrals to appropriate services, helping clients navigate emergencies effectively. 3. Case management and advocacy. LCSWs connect clients with essential resources, such as housing, healthcare, financial assistance, and vocational training. They advocate for clients facing systemic barriers and ensure they receive the support needed to improve their quality of life. 4. Substance use treatment. LCSWs play a key role in helping individuals overcome substance use disorders through motivational interviewing, relapse prevention planning, and harm reduction strategies. They address both the psychological aspects of addiction and the social factors contributing to substance use. 5. Support for trauma and abuse survivors. LCSWs provide specialized therapy for individuals who have experienced trauma, abuse, or violence. They create a safe and empathetic environment to process these experiences, rebuild self-esteem, and develop resilience, helping clients regain a sense of control and stability.